Hi, this is Marwa Abdallah. I am professor of dermatology at Ain Shams University, and I am going to present to you now the natural resistance of the skin and the common skin infections. Actually, this is an overview for the upcoming lectures that you are going to meet in the next program. Our intended learning outcomes from this lecture is to know the mechanisms of body defense, to explore the predisposing factors for infections, to recognize the common skin bacterial, mycobacterial, viral, parasitic, and fungal infections, and to know the preventive measures for different skin infections. The natural resistance of the skin is due to the following factors. The first one is that our skin is an integrated cover of the body. It's an integument. Second is that our skin is relatively dry. It is not very dry and it's not very wet. If it is very wet, it will be macerated and it will invite infection. And if it is dry, it will be cracked, very dry, it will be cracked, and it will lead to an emergence of the or introduction of the bacteria into the skin. The constant skin shedding by losing the outer horny layer is also a factor that aids in the natural resistance of the skin. As is the pH of the skin, which is relatively acidic, having a pH of 5.5. The sebaceous gland secretion provides resistance to the skin, and this will be discussed in the face-to-face session. The antimicrobial peptides are a number of peptides that also help in the natural resistance of the skin. Lastly, the cutaneous flora, and the cutaneous flora are present in huge numbers. They are commensals. They are present on the surface of the skin and within the follicles. And the most prominent examples are the Staph epidermidis, Staph hominis, Propionibacterium acnes, and Malassezia or Pitrosporum ovale. This is a table adapted from the textbook of dermatology to show you the location on the body sites of each commensal. The predisposing factors for infections are, as you already know, unhygienic conditions and overcrowding, hot, humid climate, malnutrition, for example, iron deficiency anemia, decreased immunity by having diabetes mellitus, steroid intake, chemotherapy, HIV, and others, presence of a septic focus or systemic disease, and the presence of breaches in the skin as by itchy skin conditions, wounds, and minor trauma. The common skin infections that you are going to study in this program are the bacterial. The main two organisms causing pyogenic infections are Staph aureus and beta hemolytic streptococci. Mycobacterial infections, mainly Mycobacteria lepri and Mycobacterium tuberculosis. Mycobacterium tuberculosis is just nice to know. The viral infections are herpes simplex, varicella zoster, human papillomavirus, and pox virus. The parasitic infections are Sarcoptes kibii and Pediculus humanus, and the fungal infections are dermatophytes, Candida, and Malassezia. So we are going to be waiting for you and all your questions in the face-to-face session. Thank you.